Hey, Dr. Lindsey and Wendy. We're on COVID quarantine, and Wendy has composed a few questions that we get a lot, and so we're going to go through those.
They call and they say, does your doctor specialize on FUE or FUT? And then I say, my doctor specializes on both. And he says, why do I need one that specializes on both when I want FUE?
Because not everybody's a candidate for FUE. FUE is ideal for people that don't need a ton of hair, who have thick, resilient hair with good roots that are hard to damage or more difficult to damage than skinny hair, and who need to wear their hair less than 1/4 of an inch. For people that don't fall into that, strip may be a better choice, but we discussed both of them and then usually let the customer make the decision on what they want to do. But at this office, I've done 4,060 some facelifts. I'm pretty good at sewing. My average strip scar, as I try to put in almost all my videos, is roughly 1 millimeter wide. And my haircut, which is pretty short, would cover 29 out of 30 hair transplant scars at this office. And so if you can wear your hair like me, by and large, strip is going to work better and be more cost effective for you. But if you're really nervous about it, and particularly if you're already a bad scar and you don't need a lot of hair, or you are a bad scar and you have good hair, FUE is probably the better choice for you. And we've done a couple of FUE videos already this morning. It works really well, but you have to pick the right patient and you have to be very careful.
So it's important for the patient to pick a doctor that specializes on FUE and FUT, so they could recommend the procedure that would most likely be the best for them.
Well, I think what the real issue is that most people that do just FUE are people that don't do a lot of hair, that bought a machine that supposedly is a new profit center in their office that allows them to bring rental techs in or one guy in to run this machine, and then they don't really know anything about hair. I mean, we see that all the time. In fact, we counted it up. We saw that 119 times in the year 2019. And so, if you get somebody that only does FUE, and they used to do strip and they do a really good job, that's fantastic. But if you get somebody that's just picked up hair and they do FUE because they got a machine that does it, that's a big worrisome sign.
So I guess patients need to look for somebody that specializes in hair that does.
That posts a lot of results.
So, okay.